everyone, welcome back to another episode of NOMS Lab. I am your host, Angela Oluwa Ayodiri. Today we're going to be talking about something that feels so normal. Where do you go to when you feel sick? Do you go to the chemist? Do you go to the pharmacist? Do you go to the hospital? Oh well, we're going to uncover that today. We asked some of my colleagues where they go to, and the next voices you hear are from them.
So when I'm ill, I usually visit the pharmacy, but I'm always hesitant at first. So it mostly depends on the severity of the illness.
First, I head for my bed, try to get a good sleep. If I wake up and still feel the same way, I head straight for the hospital.
My first instinct would be to self-medicate, but I think after a few days of self-medicating and I don't get better, then I run to the hospital.
Sounds familiar? What they said is also our everyday reality. Most people don't go to the hospitals. We typically will call our grandma home and say, grandma, that traditional medicine you used yesterday, can you share the recipe with me because I'm feeling a bit under the weather? And this has a lot of implications for us. In 2021 alone, we had about 50,000 Nigerians who died from drug resistance issues. And many more keep dying by the day. And we keep asking ourselves, what shapes the reason why people do what they do? Why is there some form of mistrust in the health system that prevents them from going to the hospital? And how is our community and everyone around us shaping these ideologies? Oh well, we're going to unpack that today. And with me to do that is Dr. Mercy, a medical officer with over 3 years of clinical experience and a strong passion for maternal, child and community health. She's currently pursuing a master's in public health at Brunel University, London. Beyond the clinical work, Dr. Mercy is deeply committed to creating awareness around public health issues, regularly engaging with communities to promote healthier lifestyles and better health outcomes. It's great to have you with us today.
It's good to be here. Thank you for having me.
Awesome. So let's just get right into the conversation. You heard what my colleague said, and most of them spoke from different perspectives. You see someone who said, I just go to sleep, man, I'm tired, and then if I don't feel better tomorrow, I go to the hospital. Or someone who says, no way, pharmacy is the best place I'm going to, first of all, before I go to a facility. So when you see patients come to you, what are those excuses or what are those reasons they give to you for why the hospital is not their first point of call?
Okay, so there are several reasons why a patient may not come to the hospital as their first point of contact. Some of them prefer to go to the chemist, like you say, and their reasons may be that, there's long wait time at the hospital, and they may not have the luxury of time to wait to be seen by a doctor, so they'd rather just walk into a random chemist and ask for, I have a headache, give me something,
give me Panadol.
Yes, I'm having a stomach pain, give me what you have, and they don't even check the prescription, the brand, nothing. They just take it in and then they continue on with their day. Another reason may be cost of consultation. The average Nigerian, unfortunately at the moment, may not be able to afford a consultation at maybe a private clinic, and also they don't have the time again to go to a primary healthcare center to wait. So that's why they'd rather do that or pick the other option. Fear of being judged is one of them. There are some illnesses or some conditions that patients have that they feel if they go to the hospital, the doctor will say, why do you have this and you haven't come in or why are you even coming in for this, So many of them would rather go to somewhere where they don't ask them questions, they just give them what they want and then they go. And then distance as well. Distance from the hospital to their place of residence. Some of them feel, the hospital is too far, I'll just go to Mr. Ebuka's shop, get my medication, and then I'll be fine. I'll pray to God that
everything goes well at the end of the day, right?
Yes.
Thanks for sharing that. And I think this actually goes beyond just personal habits. And I feel like society somewhat places some expectations on us. So for instance, with the long wait time that you mentioned, I figured that a man and his friends, they'll probably tell him, I'm sorry, like, man, where you be? Why you they go hospital, go spend time? No say time, no money. Those kinds of things are people just subconsciously doing their environment, and then it places some form of expectation on, what, if I'm sick, there's a chemist or there's a PPMV close to me where I can just go and buy. And in fact, those ones are already doctors in their own right, so they can treat you for whatever it is. Or is it a mother who just gave birth And the grandma is like, oh no, you need to put all of these concussions together, and use for you to get better. So I feel like the society in a way has also played some role in some of those choices that people make. And the results, the consequences are really crazy. And let me give you a case in point here, right? Let's see a young man in Kano that treats constant stomach pain with painkillers from the chemist. He keeps working until one day, ulcers rupture, and he collapses. By the time he gets to the hospital, it's almost too late for anything to be done. Now, this is a story, right? But he points to like the bigger pattern of the issues that we see and what exists in our society. So with this case in point, and also some of the responses we've heard, earlier on from my colleagues, what risk do you see when people continue to self-medicate or delay treatment?
Okay, thank you for that question. It's unfortunate that we are seeing these kind of cases in our society today. Even someone as young as that, going through a ruptured ulcer and then dying. It's not supposed to be, but there are risks associated with self-medication, such as misuse and abuse of medication. Some people just get medications, they don't know how to use it because they don't get prescription from the hospital, and then they overdose or they underdose and they don't get their solution. Drug addiction is one of them, one of the ills right now. So many young people are having drug addictions because of self-medication. Outside Nigeria, there are some medications that you cannot get over the counter, such as tramadol, morphine. But
you were surprised.
Yes, you're surprised how you can easily get them here in Nigeria. You can just walk in and say, give me tramadol, and they're like, how many sachets do you want? So this is one of the risks of self-medicating. Another one is complications such as organ damage. Frequent drug use or medications that you're not supposed to take damages the organs, like the liver, the kidneys, because they are the ones that filter medications. The kidneys, you put so much load on your kidneys, and then you're also taking alcohol, which the kidneys are the ones that are overworking and filtering. So you need to just know the balance and avoid taking medications that you do not need or taking prescribed medications.
I think those consequences, when you begin to put some numbers behind it, and what we see, especially with our health outcomes in Nigeria, you will know that, man, this is a serious issue. And this is us saying to everyone who thinks that, it's okay to just enter into the chemist and just buy anything that works or any antibiotics. They're actually processes because the consequences are grave. I'm going to give you an example, and this is not, I feel like this also doesn't only relate to drugs. There are so many things that norms are sort of complicated. I was at an event earlier in the year, and we're talking about lab testing. I think it was malaria, as simple as malaria testing. I tell you now, if I come down with fever, I know it's malaria. I'm going to the next chemist and say, guy, Alpha, give me anti-malaria. I'm not feeling so well. I have a headache. And, they just prescribe something for me. But there's that point of where I know there are malaria programs trying to do like test and treat right now. We need to be able to test, even know what strain of malaria that is. So you see that at this point, it's not even just drugs. It feels like it's everything, with testing, with medication use. Every other thing that applies to you as an human is my first instinct is to do what I think is right before I actually now seek some professional help. But the truth is the consequences are dire, and we need to, stray away from that. I'm just going to go next to something I'm calling like trust. I would say trust with the primary healthcare system, right? When we've talked about the consequences, right, we know that in a way, trust is also somewhat part of the mix in this picture. So I'll give you an example. If I really trust that I go to a PHC and they are going to attend to me, and no nurse is going to shout at me and say, why are you just coming? See you, all your mates have done this since yesterday, but you are just showing up. I feel more obliged or inclined to go to the hospital. And sometimes I've heard some women say that the PHCs often sometimes scold them, for coming at when they come, or men complaining of the wasted time that we talked about earlier on? Or is it Gen Zs that feel like, oh boy, everything is tech these days, let me just go online, ChatGPT is my doctor. Yes. And he can give me the answer versus, a clinic. From a system point of view, right? Why do you think PHs struggle to build this trust so that people can actually access the services that they need there?
Okay, so at the moment, the trust that the average Nigerian patient has in primary healthcare centers is at a low. It's at a low. One of the reasons may be that they don't have that individual, like tailored patient consultations. When they walk in, they're being treated the same. The Mr. A is treated like Mr. B, and then they don't have time to listen to the patient's complaints. And when you don't listen to your patient, they lose trust in you. They say, this person, either the person is not competent or the person is not patient enough to listen to my complaints, and then they just say, okay, I'm not going there anymore. Over the weekend, I was privileged to partake in a medical outreach, and then we went to cater to women and children mostly, consult them, give them medications, and see how they are doing. So we had a pregnant woman that needed some consultation, and we used a primary healthcare center to do this outreach. And so, of course, they know that all these things are free. The medications we brought there are free. We want to give these people good healthcare because they are, let me just say, the lowest of the low. They can't afford this medication. So people were happy to come. But then when we asked, okay, the nurse that was working at the primary healthcare center, so we want to treat these patients. Can you get the basic amenities? Let us set up and then do what we need to do. And the nurse is asking, who is going to pay? And the pioneer of this medical outreach, she was disappointed. She was like, we are not asking you for anything. We're just telling you to do the basic thing and we will take over from there. So this is one of the reasons why the patients run away from that, because they're like, okay, I'm supposed to get my treatment first. And then you start asking me who will pay later. You save lives first. The woman was in, it was a serious situation because this was her third pregnancy. She was vomiting. She was not in a state to even think of payment. So that's one reason why we need to build more trust. You pay attention to your patients, you give them a listening ear. The cost of things shouldn't be as high as the private entities. You need to bring things down.
At the PHC level.
Exactly, especially at the primary healthcare level. So we need to pay attention to these things and then build more trust with the patients.
Awesome. Do patients typically share with you who they trust more than the PHCs and why they trust them?
Yes, they trust their fellow friends that have the chemist down the street. They trust their personal doctor friends. Like I have some relations and friends that rather come to me first.
Just come to your WhatsApp and say, Doc, how far?
When I see that message, I know that they're not trying to ask me how I am. They're
not giving you consultation fee.
Exactly. I know some people, they go to the lab, do their test, and they send it to my DM. And most of the time, I always encourage them, please go to the hospital, depending on the severity of the illness, how sick they are. If they're telling me symptoms like, oh, I just have a headache and maybe stomach pain, I'll be like, okay, I'll characterize, the symptoms and then see what I can do. But if it's beyond my power, I'll say, please go to the hospital. But yes, they trust their fellow friends and their fellow pharmacists.
Right. So you see there, when people begin to see the PHCs as unreliable and trust their friends, trust their doctor friends, trust their grandmas, then we know that we have some problem and we would not really be accessing care at the PHCs. But the good news is that these patterns can change, right? And often the people reinforcing like this unhealthy risk today can actually reinforce like the healthier ones tomorrow. And so among women, imagine if the normal advice from neighbors are, take your child to the clinic first, like you would do with your friends, telling them to go to the hospital. Or among men, what if the responsibility was defined? Get proper treatment early, not, toughing it out or manning it out, just go and get treatment. Or amongst youth, what if it was so cool to double check with a healthcare worker before taking a drug or before responding to everything ChatGPT is saying to us? Or when you look at the elders who think that traditional medicine is like the way to go, imagine if themselves or their friends referred them to PHCs. it feels like a communal thing that everybody needs to take responsibility for. And when we do those, we begin to see those change. And so I'm going to ask you now, how can pharmacists or, health workers or chemists act as allies in this case in shifting norms, even when it costs them a sale? Because if I'm a pharmacist, if I'm able to sell this drug to you, why would I tell you to go to the hospital? So how can we bring them on board to act as allies to help us do what is right?
Okay, thank you. So I think professionals like pharmacists and even chemists at their own level, everyone should know their professional limit. Everyone should know their professional limit. If you know that this is beyond my scope, I'm not meant to prescribe this sort of medication, I need a prescription from the hospital, from the doctor, you ask for that. In other parts of the world, there are some medications that you cannot get over the counter, like I mentioned before. So you need to enforce that. You can't prioritize making a sale over someone's life. Life is precious. You don't know the state of this person's health, and you don't know if their body can handle that sort of medication. So you need to enforce that. Please, have you gone to the hospital? Can I get the doctor's prescription? You get that before you give your medication. Encourage them to go to the hospital. So if we build that habit of telling the patient, this is what you need, then I can take it from here. I can now prescribe the medications for you. I think that will help with curbing this self-medication, so that it doesn't lead to death. Because there are lots of, like you mentioned before, 50,000 deaths alone in 2021, and according to World Health Organization, by 2035, they're even predicting that 10 million deaths. So it's something that we need to pay attention to.
All right. Thanks for sharing that. And I think that's really important. And I know that at the national level, there are some deliberate acts to. There's something called the tax shifting, tax sharing policy, just given what we know about the manpower and healthcare worker situation in Nigeria, but still limiting care to what they're able to provide. So for instance, like the chemist that you talked about, at the chemist, we know that this is the suite of services that you're supposed to provide. When a patient comes to you, beyond the suite of services you're supposed to provide, refer the person appropriately. And I think if everybody does that, it helps us change the narrative, and everybody becomes accountable for the change that we want to see. So it's been an interesting conversation so far today. We've talked about why people do the things they do, and we see that norms, communities, our families, our friends, they have a lot of influence on us that sometimes we don't agree with. Sometimes we think they do not have this influence on us, but they actually do, and we're seeing it play out in the real sense. Communities, pharmacists, healthcare workers all have a role to play, during the suite of services they're supposed to, helping to build the resilience system and the trust that we want to see in the healthcare system, so people can always come to them beyond these norms. And so as we wrap up, I'm just going to ask you, one last question, right? If you could fix one thing in the system to rebuild trust, what would it be?
Okay, thank you for that question. I think there's just there are lots of things that I could fix. I can't say right now that there's just one thing. And I think one of the things is engaging with your community. Knowing patients' needs. What do they need in their community, in a particular community? Like the medical outreach I mentioned earlier. You go into the community, you know that, okay, they're suffering from malaria in this community, and then you can help with health talks. You can tell them, okay, avoid keeping stagnant water, just prevention, encouraging them to do more prevention, and then whenever they fall sick, so always go to the hospital and then get medical care. So that's one thing we need to do, is engaging with our communities, local communities, and even in your wider communities, and then we can be able to help to rebuild trust.
Thank you so much. So you've heard it all. You are the agents of change that we want to see. So are you ready to be that change that you want to see in the community? Thanks so much for being with us today, Dr. Mercy.
Thank you for having me.
Yeah, awesome. And for everyone, Today we've heard that health-seeking behavior is not just generic. Women, men, youth, elders, everyone has different unique norms or issues that they face, and how it addresses how they seek healthcare. And so to change the narrative, you need to do something. Tell the person next to you, do not self-medicate. Go to the hospital and seek care. It's been awesome chatting with you all today. I'm Angela Oluwa Ayodele. You can follow us on our social media platforms displayed on the screen or in the caption right now. Just click and follow us. And if you have any questions, feel free to retweet at us and we'll be there to respond all the way. Thank you guys, and see you at the next episode. Bye.